As travel restrictions ease up a little bit, maybe you're dreaming of a holiday vacation. I know I would love that.
I would too.
After all, we deserve it, don't we? After
sure
what we've
do.
all been through.
Oh, yes.
What you don't deserve is an unexpected cancellation or worse, quarantining in your hotel room.
I don't want that. Better Call Harry explains how travel insurance has changed since the pandemic and what kind you need to have before your next big trip.
It doesn't matter if you're flying out international or domestic. If you're spending hundreds or even thousands of dollars on a trip, you need coverage for your trip and for your health.
All they've been doing is stringing us along.
Mark Drury spent 7 months fighting ASAP tickets for a $2,300 refund. His flight was one of thousands canceled early in the pandemic. Even though the DOT mandated refunds, he needed our help to get it. He bought trip insurance, but back then, there was no coverage for COVID. Like an iceberg, the pandemic forced the travel insurance industry to change course.
I would say a 180 several times over. Travel really has changed a lot. People are a lot more cautious, but they still want to leave home.
Kathy Kimmel is a travel insurance expert for InsureMyTrip.com. The company compares policies and offers quotes. At their sites and others like TravelInsurance.com and SquareMouth.com, almost every insurer now offers coverage for COVID.
Are more people buying insurance? Have they caught on that they need it?
Yes, they have. And primarily they're worried about, well, what happens if a country closes down?
Or what if you test positive after you arrive? Who's paying the bill? Without trip insurance, it's you.
With all the bells and whistles, you're probably looking at about between 8 and maybe 11%.
So, if your trip is $2,000, you'll spend around $200 for trip insurance. Experts now recommend buying a cancel for any reason policy, along with trip interruption, emergency medical coverage, and emergency medical evacuation. Expenses your private health insurance may not cover.
A medical expense overseas is huge.
Insurance is not my favorite thing to talk about or deal with, but it's a necessity, especially if you're spending this much money on a trip.
And it doesn't matter if you're flying or cruising or driving. One of the first calls should be to your health insurance provider to find out what's covered and what's not. I'm Better Call Harry, CBS 46 News.